Okay, so I just arrived on the scene. The scene is safe. The patient has an abdominal injury and it appears to be an abdominal evisceration. There's only one patient on the scene. The scene is safe. Patient is alert and oriented, and it appears that the patient does not need spinal immobilization because the patient does not have any neck injuries. So for airway, breathing, and circulation for the primary assessment, for airway, we're going to check for the nose and mouth to see if there's any vomitus, blood, or any kind of secretions coming. So I'm going to do a head tilt, chin lift to check. So I'm going to do that. Boom. Okay, so it appears good. So for breathing, I'm going to auscultate for lung sounds, and I'm going to assess for the tidal volume, looking at the chest rise and fall. So I'm going to assess that right now, auscultating. Okay, so it appears that the patient has a respiratory rate of 16. The heart rate is 74. The heart rate is actually a little bit higher. Heart rate is around 80 or 90 due to the wound. And then the SpO2 is at 93%. So with the evisceration, we're going to be putting a non-rebreather mask over the patient. So we're going to be putting the non-rebreather mask on at high liters per minute, so 15 liters per minute to boost the oxygen. So I'm going to be assessing the patient's ears and neck, and so I'm going to see if there's any deformities or if there's any pain. Do you feel anything?
No.
Okay, I'm going to check for the back. Do you feel any pain in your back at all?
No.
Okay. Anything on your chest besides your abdominal evisceration, your wound?
No.
Okay, I'm going to check for arms, deformities, anything. Okay. Anything on your buttocks?
No.
Lower back? No, just the evisceration. Anything on your legs?
No.
Okay, well, so for the evisceration, I'm going to apply a sterile dressing and an occlusive wrap, and we're going to have that on. You don't want to touch it or push the organs back into the body. That wouldn't be good. And then for the circulation of the skin appears normal, starting to feel a little cool, but we're getting the patient on the oxygen right away. But we're going to place the patient on the stretcher and then get her right out of here. And the scene is all good now.